You are watching or listening to Voice of the Inland Empire, coming to you from the beautiful KVCR studios on the campus of San Bernardino Valley College. Our guest today is Chuck Kiskaden, who is President and CEO of Health Benefits Advisors. And Chuck, in the first segment, we were kind of talking about Obamacare here and now, you know, what's already been implemented and some of the things that are yet to be implemented. But I think a question on a lot of people's minds, both businesses and individuals, is when we watch the debate between Romney and President Obama, the distinction between the two of them on their thoughts, feelings, and stance on health care was quite clear. With Romney saying, day one, I'm repealing it, and Obama saying, give me 4 more years to really make it work and make it work well. So I wanted to find out from your perspective what that means come November 3, the day after the election. I think obviously when Romney says I'm repealing it my first day, we all know that, you know, he's not really going to be able to do that day one. But what will he be able to do? And if President Obama regains or is reelected, you know, what does that mean come January 1, 2013?
There's a number of things to keep in mind. Certainly, a lot of things would have to happen for Romney to be able to affect what he says he'd like to try. To totally repeal it, the Republicans would have to be in control of the Senate. They would have to be in control of the House and obviously have Romney as president. The likelihood of that is pretty slim based on everything that I've been reading and what we follow.
Well, Republicans have the House now, will probably keep that, but may or may not get control of the Senate.
That's correct, and it'd have to be total control. They'd have to have 60 votes, totally control the Senate in order to make any changes. So most likely what's going to happen November 3rd, even if Romney gets in, is a continuation of the law as we see it right now. Certainly, as the Republicans have said, they can do things to affect the funding of certain parts of it, and that can affect how slowly it rolls out. But so many things are already in place. All of the states have already had to declare if they're going to have their insurance exchanges in place, and more than 30 or 40 already have the plans in place. The ones that don't have plans in place, the federal government steps in and creates an exchange, so that's already started.
Explain to us what that is. What is an exchange? How does that work?
The insurance exchange is going to be a place where an individual that's interested in insurance or a company that wants to buy insurance can go to a website, most likely, and on that website will be a lot of options. There will be a number of different insurance carriers that have agreed to provide the essential benefits, and that's what they're termed as essential benefits. And that's the minimum level of benefits that the law allows.
So would you call that catastrophic?
No.
Or is it more than catastrophic?
It's much more than catastrophic. Essential benefits will cover the medical as far as the doctors, the hospitals, it'll cover nursing home care, it'll cover rehab, all the different things, and some states are even throwing in chiropractic and other kinds of stuff.
Wow.
So it's more than just catastrophic.
I want one with psychiatric care included.
After these elections over, we probably will all need extra help there, that's for sure. It's confusing just right now because when it rolls out, the insurance exchanges, which a person can go there and they can shop, they'll be able to see all the carriers, all the plans that meet these essential benefit requirements and the pricing. Mm-hmm. So you'll be able to look and choose and do some shopping right online. And then you can buy online. Just recently, California decided that the insurance exchange, which is already in place, has decided that they will work with insurance brokers, like my company, and that we can represent employers to buy products there. So there will be assistance for employers to understand that and explain it to their employees. So that's going to happen pretty quick.
Okay.
But that happens January 2014. During 2013, there's going to be everybody's going to be barraged with advertisements and information and communication about the insurance exchange. The insurance exchange has already contracted with a PR company to start doing ads to let people know that they're going to be there. Wow. I've read where they expect within 10 years to have 3 million people in the California exchange itself. So they have huge plans about enrolling people. And we're talking about small groups and individuals, people that previously didn't have insurance and are now looking for a place to buy it.
What about those with pre-existing? Will they still be able to buy in through the exchange?
January 2014, that's the in 2014, That's the only place they can buy in is through the exchange.
Got it.
The exchange will be available for individuals and for groups of less than 50. So that's the case. And as you and I were talking about earlier, there's some question about if you have less than 50, what are all the other things that happen in January 2014?
Mm-hmm.
That's when the pay or play part of the law. That's if an employer doesn't provide insurance, they're not playing in the game by providing insurance, then they have to pay a penalty. That only affects
the Supreme Court has decided is not a penalty, but is a tax.
Is a tax. On the individuals, it's considered a tax. They didn't address the penalty part for employers.
Oh, okay.
They were talking about individuals. But it's still a penalty or tax, whichever the case may be. But it doesn't affect employers with less than 50 employees. So small groups of less than 50 don't have to worry about the penalty side of it. They do have to worry about all the communications, letting employees know what's available. There will be subsidies for employees that make less than a certain dollar amount, that the federal government will provide subsidies to help people buy insurance.
Mm-hmm.
Medi-Cal will change. The requirements to qualify for Medi-Cal are being raised. The bar is being raised significantly. So there'll be 2 to 3 times as many people qualifying for Medi-Cal. There's going to be a lot of changes starting in January 2013.
And how is this going to be paid for?
There are a number of different ways that, as I mentioned in the earlier segment, there's a transition of cost of about $800 and some billion from Medicare. There's subsidies now going to what are called Part C Medicare Advantage plans, about an $800 billion subsidy. That's going to end, so that will help pay for part of it. There are other tax issues that have come up. I just recently did a presentation for some CPAs, and I had 10 different slides of all the tax sides of this law.
Because they've got to generate the money from somewhere.
That is correct.
I mean, it's not, I know it's sometimes been positioned as just we're going to cut some loopholes and cut this and cut that, and that'll cover all the extra costs. And I have a friend who, he's Canadian, lives in Canada, born there. And, aside from some of the other issues related to socialized medicine, the long waits and everything else, he says, yeah, we're not paying for it or we're not paying much directly, but our taxes are way higher than yours because the money's got to come from somewhere.
Well, there's plenty of money in the medical system right now. It's just being allocated differently. Yes, it's certainly going to be a question. My question in my mind, for example, is with the insurance exchanges. You have all these people that have pre-existing medical conditions. You have people that haven't been insured before, and they're all going to be put into this insurance pool called an exchange. It's got to be more expensive just because of the adverse selection to cover it. There's a lot of things that are happening. Yes.
Now, Chuck, if someone wants more information and they want to get a hold of you and they want to learn about the exchanges, they're a small business, they maybe want to find out what their options are, they're an individual, how do they get a hold of you?
They can go to our website. It's going to be on the bottom of your presentation. It's healthbenefitsadvisors.com. Or they can call me. The phone number's on there as well. I'd love to chat with them. And any group that would like to have a presentation on this whole Obamacare thing, just give me a call and I'll come talk to them.
That's great. And if you missed that, just check out our website at voiceoftheinlandempire.com and we'll get you connected. Chuck, thank you so much.
My pleasure.